I've spent over 2 decades opening chests and repairing hearts. I've held beating hearts in my hands. I've felt the difference between a heart that's strong and one that's quietly losing a fight nobody knew it was in. And after all those years, after all those patients, here's what haunts me most. Some of the worst damage I've seen on my operating table wasn't caused by poor diet. It wasn't caused by smoking. It wasn't caused by genetics. It was caused by what patients took before they went to bed. Pills they trusted. Supplements they bought without a second thought. A glass of something they believed was helping them relax. And while they slept, their heart was under attack from the very things they thought were keeping them safe. My name is Dr. James Carter. I'm a cardiothoracic surgeon with over 2 decades in the operating room. And today, I'm going to tell you about 5 specific things that millions of seniors take before bed every single night that are quietly setting the stage for a heart attack or stroke while they sleep. Some of these are sitting on your nightstand right now. Some of them your doctor prescribed without ever explaining the nighttime risk. And one of them I recommended to my own patients for 15 years before the data forced me to stop. Stay with me. What you learn tonight may be the most important thing you hear this year. Before I get to the 5, I need you to understand something about what happens inside your body between the hours of midnight and 6 in the morning. Because once you understand this, everything else in this video will make immediate sense. Most people think that when they fall asleep, their heart takes a break. That sleep is passive. That the body just powers down. That is not what happens. Not even close. When you fall asleep, your cardiovascular system shifts into a complex repair cycle. Your blood pressure is supposed to dip, usually 10 to 20% lower than during the day. Your heart rate slows. Your arteries relax. It is a biological reset, a form of maintenance your body has been running for your entire life. But after 60, that system becomes less reliable. The blood vessels stiffen, the pressure regulation gets less precise, and the margin for error gets much, much smaller. Think of it this way. During the day, your cardiovascular system has backup mechanisms. It can compensate, it can adapt, it can absorb mistakes. At night, most of those mechanisms are offline. The body is running on a skeleton crew. That is why nearly 50% of all fatal cardiac events in adults over 60 happen between 10 at night and 6 in the morning. Half while you sleep, while you're defenseless, while your family is in the next room. And here is the part that changes everything. What happens during those dangerous hours is largely determined by what you did, what you took. In the 2 hours before you closed your eyes, the pill you swallowed, the drink you poured, the supplement you assumed was helping. Those decisions are either protecting your heart through the night or quietly loading a weapon while you sleep. Let's get to the list, and I want to be clear about something before we start. These are not exotic medications. These are not things prescribed by careless doctors. These are things you take because you believe they are safe, because they are over the counter, because someone you trust told you they were fine. That belief is the problem. Number 1, the over-the-counter sleep aid on your nightstand. Diphenhydramine. You know it as Benadryl, or Zysquil, or Unisom, or one of 100 generic versions with the word sleep on the box. Millions of seniors reach for these every single night because they can't fall asleep, and the bottle says it's safe. Here's what that bottle doesn't tell you. Diphenhydramine is not a sleep aid, it is a sedative, and sedation is not sleep. When you take this pill, it doesn't guide your brain into the natural sleep architecture your heart depends on for overnight repair. It chemically suppresses your cortex. You lose consciousness faster, yes, but you are not sleeping the way your body needs you to sleep. Specifically, these drugs suppress REM sleep, the phase of sleep where your cardiovascular system gets its deepest overnight recovery. Without adequate REM, your heart misses its maintenance window. Night after night, week after week, year after year. But that's not the worst part. Diphenhydramine belongs to a class of drugs called anticholinergics. And anticholinergics block a chemical in your brain called acetylcholine, which is essential for 2 things your body desperately needs after 60: heart rhythm regulation and cognitive function. Multiple research studies have linked long-term nightly use of anticholinergic sleep aids to a significantly increased risk of dementia, not just heart problems, Dementia, the thing seniors fear more than almost anything else, and they're swallowing the risk every night from a bottle they bought without a prescription. What should you do instead? Talk to your doctor about magnesium glycinate, 400 milligrams before bed. It supports both sleep and heart rhythm naturally. Low-dose melatonin, sleep hygiene changes that address the root cause instead of sedating the symptom. How many of you have a bottle of Zizquil or Benadryl on your nightstand right now? Check the active ingredient tonight. It's diphenhydramine. And, after what you've just heard, you deserve to know what it's doing to your heart while you think you're sleeping. Number 2, and this is the one that connects directly to the nighttime cardiac window I just described. Because when I explain this mechanism to my patients, most of them go completely silent. Ibuprofen taken before bed. Advil, Motrin, Aleve. Whatever brand is in your medicine cabinet. Seniors take these at night constantly. For knee pain, back pain, arthritis, shoulder stiffness. They take 2 pills, lie down, and assume the pain relief is the whole story. It is not. Here is what ibuprofen does to your cardiovascular system while you sleep. It blocks an enzyme that produces something called prostacyclin. Prostacyclin is your blood vessel's natural protector. It keeps vessel walls flexible. It prevents dangerous clotting. When you take ibuprofen, you remove that protection while you sleep, during the hours when your circulation is already at its slowest and your blood is already at its thickest. But that's only the first mechanism. Ibuprofen also forces your body to retain salt and water. More fluid in the system means your heart has to pump harder during the hours when it's supposed to be resting. And here is the part that should stop every single person watching this. If you take blood pressure medication, ibuprofen can completely cancel out its effect. Studies have shown that NSAIDs can neutralize the protective benefit of blood pressure drugs entirely. Your pressure rises overnight, and you have no idea because you're asleep. So let me say this clearly. If you take ibuprofen at 9 p.m. and your blood pressure medication wears off at 2 a.m., between 2 and 6 in the morning, you are completely unprotected. Your blood pressure is rising. Your vessels have lost their natural protector. Your blood is thicker, and you are lying perfectly still in a body that is fighting on too many fronts at once. The FDA put a black box warning on NSAIDs in 2005, specifically for heart attack and stroke risk, and studies show that 25% of people taking ibuprofen regularly for 4 months or longer develop hypertension. 1 in 4. What should you use instead? Topical anti-inflammatory gels deliver the same pain relief locally with 90% less absorption into your bloodstream, 90% less impact on your heart. Ask your doctor about topical diclofenac gel, or acetaminophen for nighttime pain, or curcumin with piperine for ongoing inflammation. Are you taking ibuprofen and blood pressure medication? Because one of them is undoing the other. Every single night. Tell me in the comments if you didn't know that until right now. Number 3, and this is the one that changes how you think about your entire evening. Because it doesn't come in a bottle from the pharmacy. It comes in a glass. The nightcap, a glass of wine before bed. I understand the appeal completely. It feels like relaxation. It feels like the edges of the day softening. It has been part of evening culture for generations. And somewhere along the way, someone told you that one glass was fine for your heart. Here's what the research actually shows, and I need you to hear this because it contradicts what you've been told for years. Alcohol does not help you sleep. It sedates you. There is a difference, and that difference matters enormously for your heart. When you drink a glass of wine before bed, you lose consciousness faster. That part is true, but what follows is not natural sleep. Your brain has been chemically suppressed. Your sleep becomes fragmented. Your body wakes up multiple times throughout the night, many of which you will never remember. And most importantly, alcohol blocks REM sleep, the very phase of sleep where your cardiovascular system does its deepest overnight repair. But here's what goes beyond sleep quality. Alcohol changes the way your heart beats during the night. Research has shown that even a single glass of wine reduces something called heart rate variability. In simple terms, a healthy heart doesn't beat like a perfect metronome. It adjusts constantly, speeding up slightly, slowing down slightly, adapting to every breath, every movement, every signal from your nervous system. That flexibility is a sign of cardiovascular health. Alcohol strips that flexibility away. Your heart beats more rigidly. Your sympathetic nervous system, the fight-or-flight system, becomes dominant over the parasympathetic system that's supposed to keep your heart calm and protected during sleep. And studies have documented a drop of over 50% in growth hormone release during alcohol-laced sleep. Growth hormone is critical for overnight tissue repair, including heart tissue repair. 1 glass, measurable reduction in REM sleep, measurable reduction in heart rate variability, measurable suppression of growth hormone. Every night you pour that glass, your heart loses its best window for recovery. What should you drink instead? Chamomile tea, passion flower tea, a glass of tart cherry juice, which contains natural melatonin. These give your evening the ritual of winding down without stripping your heart of the protection it needs most. Do you have a glass of wine before bed? I'm not judging you. I want you to understand what that glass is doing to your heart between midnight and 6 a.m. Tell me your thoughts below. Number 4, and this one is the quiet betrayal. The one that takes years to do its damage, so slow that nobody connects the dots until something shows up on an ECG that shouldn't be there. Omeprazole. You may know it as Prilosec, or pantoprazole, or lansoprazole, the proton pump inhibitors. The little pill millions of people take for heartburn and acid reflux, often right before bed, often for years, sometimes for decades. And these drugs were designed for short-term use, 4 to 8 weeks. That is what they were approved for. But they became so effective at eliminating heartburn that doctors started prescribing them indefinitely. Take it for life. I have heard patients tell me their doctor said exactly those words, and they never questioned it again. Here is what happens inside your body when you suppress stomach acid for years. Your body loses its ability to absorb magnesium properly, and magnesium is not a minor mineral. Magnesium is the guardian of your heart's electrical rhythm. When magnesium drops, your heart becomes electrically unstable, like an orchestra without a conductor. The rhythm falters, arrhythmias develop, and at 3 a.m., when your body is running on that skeleton crew, an unstable rhythm can become a fatal rhythm. But magnesium isn't the only thing PPs take from you. They also block the absorption of vitamin B12, and B12 is essential for metabolizing an amino acid called homocysteine. When homocysteine builds up, it directly damages arterial walls. Elevated homocysteine is an independent risk factor for heart attacks and strokes, comparable in some studies to high cholesterol, and it's being driven by a heartburn pill. A study published in the journal Gut found that long-term PPI users have B12 levels 30% lower than non-users, in a population that's already losing B12 absorption naturally with age. And here's the irony that keeps me up at night. Many seniors take ibuprofen for pain. The ibuprofen damages their stomach, so their doctor prescribes omeprazole to protect the stomach. The omeprazole depletes their magnesium. Their heart rhythm destabilizes. Meanwhile, the ibuprofen is also raising their blood pressure and canceling out their blood pressure medication. 2 pills, each one prescribed to protect something, both quietly damaging the heart from different directions simultaneously. If you've been on a PPI for months or years, do not stop abruptly. There is a rebound effect. Acid surges back harder than before, you feel worse, and you go right back on the drug. Ask your doctor about a gradual taper, and ask this question at your next appointment. Have my B12 and magnesium levels been checked? If the answer is no, ask for the test. Write that question down right now. How long have you been on omeprazole? Months? Years? Has anyone ever checked your magnesium? That answer matters more than you might think. Number 5. I saved this for last because it is the one that changed how I practice medicine, and it is the hardest one for me to talk about. Calcium supplements. If you are a woman over 60, there is a very good chance that at some point a doctor looked you in the eye and said, you need to take calcium for your bones. 1,200 milligrams a day. Take it with food. Maybe take it before bed along with your other pills. It sounds like common sense. It sounds responsible. It sounds like exactly what a caring doctor would recommend. I know, because I recommended it myself. For 15 years, I told elderly patients, especially women, to take calcium supplements. Routinely, reflexively, without hesitation. Because that is what I was taught. That is what every guideline said. That is what every colleague did. Then I read a meta-analysis published in the British Medical Journal. 15 randomized controlled trials, nearly 12,000 patients, and the findings stopped me cold. Calcium supplementation without vitamin K2 and vitamin D3 was associated with a 30% increase in cardiovascular event risk. 30%. Here is why. When you take a calcium supplement, it creates a sudden concentrated spike of calcium in your bloodstream. Your body cannot direct all of that calcium to your bones fast enough. The excess has to go somewhere, and one of the places it goes is your arterial walls. Calcium deposits in arteries. The arteries become rigid, calcified, like pipes slowly filling with mineral deposits. And I have seen what those arteries look like from the inside. I have held them. I have tried to repair them. The calcification makes everything harder. The surgery, the recovery, the outcome, the calcium you get from food, dairy, leafy greens, sardines, does not create this problem. It's absorbed slowly and used efficiently. The danger comes from the concentrated supplemental dose. The pill. The one you take every night thinking you're doing something good for your body. When I read that BMJ data, I thought about every patient I'd said those words to. Every woman taking her calcium every night because her doctor told her to. I did not feel guilty. I could not have known what the evidence had not yet revealed, but I felt responsible. Responsible for making sure the next patient gets the complete information. If you are taking calcium supplements, do not stop abruptly if you have documented bone density loss. But bring this question to your doctor. Should I be taking vitamin K2 and vitamin D3 alongside my calcium? For most patients, the answer is yes. K2 as MK7, 100 micrograms daily. D3, minimum 2,000 IU. And wherever possible, get your calcium from food first. Supplements to fill gaps, not as the primary source. Are you taking calcium before bed without K2 and D3? That one missing piece could be the difference between protecting your bones and calcifying your arteries. All right, we've covered 5 things, and I need to reframe this conversation before you leave. Because the last thing I want is for you to walk away feeling like everything on your nightstand is the enemy. That is not the message. The message is that your bedtime routine is one of the most powerful medical decisions you make every day. And now you know how to make it differently. Here is what a heart-safe bedtime actually looks like. A glass of water, not wine, 1 to 2 hours before you lie down. Magnesium glycinate instead of diphenhydramine for sleep support. Topical pain relief instead of oral ibuprofen if your joints are aching. A conversation with your doctor about whether you still need that PPI and whether your B12 and magnesium are being monitored. And if you take calcium, the addition of K2 and D3 that changes the equation entirely. Set your bedroom to 65 to 68 degrees. Keep a glass of water on the nightstand. And tonight, before you take anything, line up every pill, every supplement, every drink you consume in the last 2 hours before sleep. Look at them and ask yourself one question. Do I know what each of these is doing to my heart between midnight and 6 a.m.? I want to tell you about a patient. I'll call her Vivian, 73 years old, retired librarian. Quiet, careful, organized about everything in her life, including her health. Vivian had a bedtime routine she followed like clockwork. 2 ibuprofen for her knees, an omeprazole for the reflux the ibuprofen caused, a calcium supplement for her bones, a Benadryl because she couldn't sleep without it, and a glass of red wine because her sister told her it was good for the heart. 5 things, every night, for over 4 years. She came to me after waking up at 4 a.m. with crushing chest pressure that radiated into her jaw. Her husband called 911. She was in my operating room by sunrise when I reviewed her case afterward. Her blood pressure medication had been neutralized by the nightly ibuprofen. Her magnesium was critically low from years of omeprazole. Her coronary arteries showed calcification beyond what I would expect for her age and health profile. Her sleep quality had been destroyed by the combination of alcohol and diphenhydramine, both suppressing the REM phase her heart needed for overnight recovery. 5 things. None of them felt dangerous. None of them looked irresponsible. Every one of them was something she did because she believed it was helping her. After her recovery, we rebuilt her bedtime routine together. Topical gel for her knees instead of oral ibuprofen. A gradual PPI taper with her gastroenterologist. K2 and D3 added to her calcium. Magnesium glycinate for sleep instead of Benadryl. Chamomile tea instead of wine. 6 months later, Vivian sent me a note. Her blood pressure was lower than it had been in years. She was sleeping through the night for the first time in a decade, and she wrote something at the bottom of the note that I will carry with me for the rest of my career. Dr. Carter, I thought I was taking care of myself. I was taking care of everyone else's recommendation. Nobody ever asked what all of it was doing together. Here's what I need you to understand. This is the single most important thing I will say today. Every pill, every supplement, every glass you consume before you close your eyes determines what your heart faces between midnight and 6 a.m. Your bedtime routine is either protecting your heart or quietly attacking it. And tonight, for the first time, you know the difference. Let's bring it all together. 5 things seniors take before bed that are putting their hearts at risk while they sleep. 1. Diphenhydramine, Benadryl, Zaquil, Unisom. Sedation is not sleep. It suppresses the REM phase your heart depends on and increases dementia risk with long-term use. 2. Ibuprofen. It removes your blood vessel's natural overnight protector, forces fluid retention, and can completely cancel out your blood pressure medication while you sleep. 3. Alcohol. That glass of wine fragments your sleep, blocks REM, reduces heart rate variability, and strips your heart of its best window for overnight repair. 4. Omeprazole and PP-is. Years of silent magnesium and B12 depletion. Your heart rhythm depends on minerals this pill is quietly taking away. 5. Calcium supplements without K2 and D3. The excess deposits in your arteries. 30% increase in cardiovascular event risk documented in a major clinical review. Which of these 5 were you taking tonight? Believing it was helping you? Tell me in the comments. I read every single one. And your answer might help someone else recognize the same pattern in their own routine. If this video opened your eyes about even one pill on your nightstand, share it tonight. There is someone in your life right now, a parent, a partner, a neighbor who lives alone, someone over 60 who lines up their pills every evening and has never once asked what all of them are doing to their heart together. That one share could change a conversation that saves a life. If you haven't subscribed yet, please do. Every week I bring you honest, evidence-based information that I wish every one of my patients had heard long before they ended up in my operating room. Take care of your heart. It has been working for you every single minute of every single night for your entire life. The least we owe it is knowing what we're asking it to carry while we sleep. And one last thing. Everything I've shared today is general medical information based on published research and my clinical experience. Do not stop or change any medication without talking to your doctor first. That is not a formality. That is genuine care from someone who wants you to bring this information to your next appointment and have the conversation that your 7-minute checkup never made room for. That conversation, informed, specific, and unhurried, is exactly where better medicine begins.